every year for the last 35 years, we have observed a World AIDS Day, all in the aim to create awareness and stop the spread of this disease. Now this year on December 1st, we observed the same under the theme, Let the Communities Lead. Joining me for this episode is Othaya Level 4 clinician Beatrice Njoroge, who is going to be helping us. We are together going to find what have we been doing right and what should we keep on doing and what exactly haven't we done. So sit back and let's learn together. I am your host, Mumbi Mavuti, and with me here, like I mentioned, is Dr. Beatrice. Thank you so much for joining us and for making time for us. We are very grateful. So kindly introduce yourself to our viewers via this camera here and tell them where you're from, what you do. Yeah.
Okay, thank you, Mumbi. I'm Beatrice Njoroge, a clinician stationed at Othaya Level 4 in the Department of Comprehensive Care Clinic, where we attend our HIV positive patient. Back to you.
Thank you so much for that. So you tend to HIV and AIDS patients, right?
Yeah.
So what is it? What is HIV and AIDS?
Okay, HIV, it's a viral infection, which it's a human immunodeficiency viral infection, which usually affects human bodies. It usually affects the CD4 T cells, which usually fight infection in our bodies. So when they interfere with the CD4 T cells, the immunity usually goes down. So the body becomes prone to some infections.
Is there a difference between HIV and AIDS, or are they all the same?
They are not the same. HIV, it's being infected with that virus, the HIV virus, whereas in AIDS, it's acquired immune deficiency syndromes, whereby once immunity is being affected, so his or her bodies, it's open up to different infection, where we find that a patient come to the hospital being infected with various infections, which are usually called opportunistic infections. There are severally of them. As we go with our discussion, we'll talk about them.
I mentioned earlier that this disease has been with us for the longest, but for the World AIDS Day, we've commemorated it for the last 35 years. What exactly is the origin of this? When did it all start, and how far have we come?
Okay, studies has been done, and they found that it's usually a virus which originated from chimpanzee, maybe during those odd days during the hunting of the animals, or in that process the human being became infected with that virus. So it became into their bodies, and then it interfered with their immunities, and then it's being transmitted from one human being to another through several means, and we'll discuss about them as we continue.
Actually, let's just discuss them now. What are some of these means that are spreading these HIV and AIDS?
Okay, one way of transmitting HIV is through sexual intercourse, where one person have sex intercourse without using a protection, that is condom. There is another way of transmitting HIV, which is can be it can be through those who inject drugs. They do share the needles, those sharp objects. They share among them, so that's another way of transmitting HIV. Another way is through vertical transmission, where a mother is being infected with the HIV, so she transmits the HIV to the infant through the utero, or during the labor and delivery, and during breastfeeding. Those are the ways of transmitting HIV.
What exactly is the medium of transmission in all of these ways that it's getting spread? What exactly are what is the medium? Okay,
the medium is the exchange of fluids. Maybe when, like in the case of the injection, sharing the sharp object during those who are drug addicts, maybe they inject their drug and share the needles. Then there is that body fluids exchange. So that's a way of transmission. And also during the vertical transmission, where the virus go through the system and then go and affect the baby during when it's in the utero, or have I said during the labor or delivery, or during the exchange of the human fluids, mostly.
These body fluids, is it all of them? And what exactly is it? Blood? Is it saliva? What exactly do you mean when you say body fluids?
When I say body fluid, I mean the blood. When it's coming in saliva, the chances of transmission is very low, unless there is an open wound, where maybe there is an open wound, and then or in cases of when someone is fighting with another one, or him or her, but the other one, that's a way won't be transmitted HIV. But when the percentage is high during the blood, when there is blood intercourse, or there is the seminal fluids, there are this during the sexual intercourse. But when it comes to the saliva, the chances are very minimal. But we don't assume when such a patient comes in a facility with a history of being bitten by another one, they undergo the screening for HIV, and when they are screened HIV, they are given a prophylaxis to prevent them to get HIV.
And for the longest, people have assumed that, and I believe this is the cause of the stigma associated with HIV. For the longest, people have assumed that it is only sex that that transmits HIV and AIDS. So as medics, are you putting an emphasis on other causes of HIV and AIDS, or other means through which it spreads?
There are other means. It's not only having sex a way of transmitting HIV. There are many other ways. I have those I have said. Those who abuse drugs, they usually uses the needles to inject their drugs. So you'll find a scenario where maybe they don't have enough drugs. So what they usually do, there is a small amount they have, one inject him or herself, then they withdraw the blood because it has circulated to one's system, so they withdraw the blood, so the blood will contain the drugs and inject themselves with that blood. So that's another way of transmitting HIV.
That's risky.
Yeah, it's a high risky. Although the other means is the vertical transmission, where a mother is being HIV infected, but he or she fails to come to clinic for the follow-up. So for the intervention, there are usually interventions which are being put in place to prevent this vertical transmission. But when the mother fails to come to clinic and the intervention are put, there is high chances of transmitting that virus to the baby. Yeah.
Now that we know that some of these causes, let's talk about testing. How often should one test for HIV?
Okay, for the testing, it's in the general population. We have general population and we have the key population. For the general population, for the current guidelines, they are usually supposed to be tested once after every 2 years. The previous guideline, the current guidelines which we are using was enrolled. We are using 2022 guidelines. The previous one, which we had been doing previous years, we were testing for general population after every 1 year. But currently, the general population are tested after every 2 years. For the key population, I mean those who are at high risk of having HIV, they are being tested after every 3 months. Yeah.
And who at this, you're saying that they are at high risk of getting HIV?
They are called key population, where we have the homosexual, we have the sexual workers, We have those who use the injectable drug abuse. So those are the key populations, and the homosexual, all those, the lesbian, all those. Yeah.
So does the stage, I understand we have stages of HIV and AIDS. Are these stages going to affect the testing? Is there a stage at which you're going to get tested and it doesn't show?
Okay, for testing, when one is being infected with HIV virus, it has an incubation period of 30 days. And during that incubation, there is high chances where you'd be tested and the test turn negative. And there are stages for HIV. There are 4 stages. One stage, the stage 1, is whereby the patient, the client is asymptomatic. He or she doesn't have any symptoms or may present with lymphadenopathy. Lymphadenopathy is generalized lymphadenopathy. Lymphadenopathy is inflammation of lymph nodes. We have different lymph nodes in our body parts. We have mostly which people know they usually call guy. People call them guy. Kuna hizi za hapa. We have cervical. So we find that when you are examining the patient, you find they are swollen. That is stage 1. In stage 2, a patient may present with a skin condition. Mostly there is a condition which is called herpes zoster, whereby it presents with the pimples which are frizz. And it's usually like following a certain pattern. In fact, that's a condition called herpes zoster. A patient may have moderate, reduced, unexplained moderate reduced body weight. And also the patient may be having a recurrent infection of upper respiratory tract infections. Maybe this patient can be treated for pneumonia or needle for a while. We have the stage 3. For the stage 3, they usually have lost their body weight severely, moderate to severe body weight loss. They may present with a chronic diarrhea, a diarrhea which has lasted for a month or above. They also present with pulmonary tuberculosis, TB. Then we come into stage 4. For the stage 4, they will present with what we call HIV wasting syndrome. When you look at this patient, they are totally wasted, and their BMI is severely malnourished. They will present with extrapulmonary TB. TB usually may affect the lungs, that is within the lungs, that is pulmonary TB. When it affects other body parts, it's called extrapulmonary TB. Maybe this patient will present with an extrapulmonary TB. There's another condition, a skin cancer called Kaposi's sarcoma. Maybe patient will present with such a condition. So that will be stage 4. But when they come to clinic, regardless of which the stage the patient is, they are screened. If they have any those opportunistic infection, they are treated and then initiated for the ARVs treatment.
Other than these opportunistic diseases and matters to do with weight, are there other symptoms or other signs that someone can see back at home or in themselves and then they lead to they have HIV and AIDS?
Okay, for that one, they may present, it's a viral, HIV, it's a viral infection. Maybe the way you will feel, it's like the way someone may feel when he or she have a condition we usually call homa. Homa also it's a viral infection. Maybe you will feel that headache, fever, malaise, such things. But you're supposed to go to the facility to be tested, to be told it's HIV. Maybe you may be feeling such symptoms. At the end of the day, it's not HIV. For the HIV, most of the conditions which I had mentioned earlier, for the stage 1, 2, 3, and 4, they are usually, most of them are, which usually direct us to know maybe this is HIV.
And a lot has been done so far in treating AIDS and not treating, let's say managing, because it's not treatable. So a lot has been done. Do we have people who get to full-blown stage at this point?
Sorry?
Do we still have people who come to the hospital showing signs of they are at a full-blown stage?
Yeah, because of, you know, due to stigma, you'll find, and also due to denial. Maybe this patient came to the VCT for testing, and he or she being tested and be told you have HIV. We'll find, you know, it's people are different. They will welcome those news different ways. Some will accept, some will deny. And those who deny usually go homes, and they will usually come back when they are in stage 3 or stage 4 of HIV. And that's when we say, this is not HIV, this is AIDS. Yeah.
So right now when you're talking about taking a communal approach towards preventing HIV and AIDS and dealing with this disease, that is how the community is participating in this. We can participate on the negative or on the positive. So once you're stigmatizing someone, you could lead them to be hiding and not go to a health facility. So let's hate the disease and love the people. So before we go for a short commercial break, Daktari, once a patient comes in that stage, are they still going to get any help?
Yeah, when they come at maybe at third stage or fourth stage, what we usually do, we first treat the opportunistic infection he or she is presenting with. There are conditions, there are those opportunistic infections whereby you can't initiate ARVs before you treat them. A condition like TB, when the patient comes with TB, and before you treat TB, even into other general population, you have to test for HIV. Maybe this patient, you diagnose for TB and the HIV for the same time. So for the pulmonary TB, you usually give them anti-TBs for 2 weeks. After 2 weeks, that's when we initiate ARVs. And when they complete for anti-TB drug, they are usually given a prophylaxis to prevent them to get that TB again. There you'll find another patient who present with cryptococcal meningitis. It's another opportunistic infection in HIV-infected patient. For such a patient, we treat first the cryptococcal meningitis for 5 weeks. Then we initiate the ARVs, and we continue monitoring patient with their CD4. After completing the cryptococcal meningitis medication, they continue with the ARVs and a prophylaxis to prevent them to get that infection again. And we monitor them with CD4. When the CD4 is above 200 in 6 different times, we usually test them after every 6 months. So after 6 months, the CD4 is above 200. She continues with the fluconazole and then repeat it after 6 months. When it is above 200, that's when we stop the prophylaxis. So we first treat the opportunistic infection, then initiate the ARVs, then the patient continue with the ARVs. Yeah.
Thank you so much for that. You're going to be coming back shortly after the break. Stay tuned.
Sharia hado ugithomera gukunya gita, piano kana migambo niyo vocals. Rehoboth School of Music maheanaga mathomo ma kirathi kia iguru muno. Macerere Nyeri Town haria opposite Naiva Supermarket, kana waranirie nao kuhetukira namba cio cia thimu 0715 031 506. Rehoboth School of Music, shoma wa rwimbo ni inada.